want to be in.
Okay, so we're going to learn about IV, spike, prime, hang, and flushing. All right? So, when you come, this will be your skills test. You will come and you'll have an order, and you will choose the right fluid, all right, and the right tubing. We have primary tubing here, all right. Primary tubing is obviously longer, okay, and has these injection ports on it, all right. And then we have the secondary tubing here, and it's much shorter, okay. So you'll want to choose primary tubing for your skills test, all right. There's clamps. There's one clamp here, and then the roller clamp here. Generally, we just mainly use the roller clamp, all right, for adjusting. And you'll get a flush, all right. Be sure that you're getting saline. We don't want to flush with anything else. The hospital has pre-filled syringes, so be sure that it says sodium chloride on it, all right. And you'll figure out the drop rate, all right. All the tubing that you're using is going to have 10 drops per milliliter, okay. So you'll figure that up. We put labels on the tubing, all right. So we have labels, and these are some examples of 2 labels. One is 24 hours, and one is you can put in the however many hours you want, okay. So, and then we have a lot of different kinds too. And you'll decide the length of how long it should be up for, how long that time is, based on a lot of things. So you'll work with your nurse or your instructor to figure that out. It's based on hospital policy. It could be up to 96 hours if it was continuously running and not disconnected. But the more we disconnect it, the greater the risk for infection. And so then that shortens that time period. Some medications are only single use or only for 24 hours, and so we change it every 24 hours. So that's some of the things that we take into consideration when we decide how long we're going to use it. And it's the tubing that we label, all right? You can see here, it's on the tubing, all right? Not on the bag. We very rarely label the bag because we're usually changing them often enough. If it's a bag that's going really slow, then we might label the bag, but most of the time we're labeling the tubing, okay? All right, so then you're going to get your tubing, and when you go in the hospital, this is really tough plastic again, not quite as tough as the IV bags, but it's pretty tough, but there's a little zipper on the back here, and all you have to do is just open it up like that, okay? And it'll open up right away.
Oh, is that a secondary?
This is a secondary. So we're going to use a primary now. Now you know how to open it. So when you first get it,
you get the idea of opening
yeah, the first thing that you want to do is close the clamp, okay? If you don't, you're going to get air in your line. Okay, so the very first thing is close the clamp. All right, and then you're going to choose your solution. Okay, you're in skills lab. You may see at the hospital people hanging them up and then taking and spiking them. Here in skills lab, they've all been spiked, and so they'll all run out. But in real life, we only spike them once, and there's a cap in there until you spike it, so it won't run out. But this is generally how I do it anyway. All right, so this is the injection port, right, where we can put medicine in, and this is where we take out, where we're going to spike in our tubing. So what I like to see is you take this off. Be sure to save all your caps here in Skills Lab. And then take this one off and put it directly in here, okay? I don't like it when I see you taking this one off and touching it and doing a bunch of stuff. This is going to touch the fluid that's going to go into your patient, all right? So we want to keep it sterile. So you're going to take this one off and then take this and directly put it right into here, okay? Twist it just a little bit all the way up to the hub. All right, and now we can hang it up. Okay. All right, and the first thing you do when you hang it up is to fill the drip chamber just 1/3 to half full. So you'll squeeze it just a little bit, all right? That way air won't get in the line. If you don't do that, you're going to get air in the line. Okay, and then you're going to slowly open the roller clamp. While you're priming, if you keep these injection ports down, then the air will come out. Air rises, right? So the air will come out and you won't get air trapped in here and then later come out into your line. Okay? So we're gonna slowly prime this and let it go through that one. Okay? And then keep the next one down while we prime it. And you can see that it's going. Alright, and then the last one, keep it down. Okay, now it's primed. You'll want to look and see if there's any air bubbles. These little tiny air bubbles, they aren't a problem. But if we see sections of air bubbles, then we need to get rid of that. If we do, then we can loosen the cap. I don't want to, if you take the cap off, if you feel the need to, sometimes it won't run really fast and you might need to loosen it, but if you take it off completely, I want you to watch it really closely and not let it touch things because it's touching the fluid that's going to go into your patient, right? All right. So you could take it off if you feel the need, and you could prime it some more into the sink if you see any additional air bubbles. Okay? But you're going to want to follow that procedure in your skills test because if you get a lot of air bubbles, I think you might have to repeat it. Okay?
Yeah, and also you want to kind of review how to get rid of the bubbles without wasting medications, because some antibiotics, they only have like 50 milliliters in a bag, and then you don't want to waste a whole lot to get rid of that bubble.
Right. Okay, so now we have our tubing. It's all primed and ready to go. We have our fluids. We'll take our order and our saline and some alcohol swabs. And go over.
Label.
Oh yes, and we're going to label the tubing. Remember, whenever we start new tubing, we're going to label it. All right, so we'll get our label and put a label on it. Okay? Here's the labels for you. Okay?
Or just stick it on.
Yeah, you can talk about it in your skills test in real life. We'll do it. All right, because we have a lot of labels in the hospital. Okay, so then we're going to go over here to our patient. Okay, so we have this guy set up for using for IVs, all right? So when we get in here, we're going to do our hand hygiene, and we're going to explain to the patient what we're doing, all right? And we want to explain that professionally, so we're not inserting fluid into him. We're using the IV to give fluid that the doctor's ordered, okay? We're going to make sure he doesn't have any questions, check the name and date of birth. We're going to do our check again, make sure we've got normal saline, okay? And then we're going to look at his IV, all right? Over on the wall there's some pictures that you will want to look at of different problems with IVs, okay? So what all are we looking for again? Redness, swelling, tenderness, leaking, okay? So we're going to look at the IV to see if there's any of those problems. All right, as long as it looks okay, then we're going to clean this outside part here. Okay. And we're going to take the cap off of this. Usually in the hospital when they first come, there's some air in them, all right? And this is kind of sealed, and so if you just push on it, it's going to spray everywhere. And it's just saline, so it doesn't hurt anyone, but it surprises people. So usually I draw back just a little bit and break that seal, and then you can gently push up until you get all the air out, okay? And then you're going to tighten this onto here. All right, and you're going to need to open the clamp and then gently flush it. How much do we need to flush with? 3 to 5 milliliters. Okay, we don't need to necessarily use all of it. Just 3 to 5 milliliters will be plenty, because we're just checking to make sure that it's patent and that it's working, that it's not hurting too much. Most patients will feel it when we first start it. All right, they'll feel it going up their arms. Some people will taste it. Okay. Okay, and then we're going to take our tubing, and if this is touch the patient or the bedding or something, we're gonna clean it off again, okay? And connect the tubing, okay? All right, now you'll notice I didn't clamp this in between. It doesn't have to be clamped if we're gonna use it right away. All right, there's a cap on it, and as long as that cap doesn't come off, it's not gonna come flowing out. All right, but when we aren't using it, we need to keep it capped, and we'll talk about that in just a minute. All right, and then you will have figured up your drop rate, and so you'll use your second hand or the one on the clock there, and you'll open this, and we'll say it was supposed to be 20 drops in a minute, so we'll count and adjust this until it is about 4 drops or 5 drops in 15 seconds, and then 20 drops in a minute. Okay? And sometimes students tell me, I never see the nurse doing that. They do it. They have so much experience that they can see that this is running too fast and this isn't running fast enough, okay? So that they do it. Usually we do it in like recovery or between transportation when we're transporting a patient around or something, okay? So they do it. But like I said, it's not an exact science either, so we would check it frequently, okay? All right, then if you're gonna disconnect the IV, you're gonna turn it off, all right? You're gonna get a cap. At the hospital they have blue caps, and you wanna be sure and use a nice new clean blue cap to cover the tubing, because we may need to use it again. Occasionally you find the tubing folded back on itself. That's not really the best practice, so we're gonna use caps when we cover it, okay? So we will disconnect it, and then we're gonna cover it with the cap and hang it up. As long as it's still good, we can hang it up for the next time, okay? And we'll want to flush the IV. We always flush the IV to make sure that there's no residual medication or anything left in there. So we'll flush, and as we're flushing, we'll flush with our 3 to 5 milliliters, and then as we're flushing, we're going to clamp it. And that will help to create that positive pressure to keep it from flowing back, okay? And then we can unhook it. All right. Now, your skills test talks about QI measures, quality improvement. Quality improvement are measures that we're keeping track of in the hospital to improve quality of the overall hospital. All right. So improve efficiency, improve safety. So what kinds of things might we monitor for IV? Some of them might be, are the IVs labeled properly? All right, so the tubing, is it labeled? Is it being changed when needed, or is it being used when it's expired? All right, are the IV sites, insertion sites labeled? Okay, are the right IV is the right IV hanging? Is it the right solution? Is it the right patient? Sometimes you can get the wrong patient's name, but it's the same solution. And maybe the computer will tell you, but maybe it won't, okay? So you need to be sure that you've got the right patient, the right medication. All right, so those are some of the quality improvement things that they're going to check at the hospital. Okay?